Hi, my name is Israel Lowy. I'm Vice President of Translational Science and Clinical Oncology at Regeneron. I'm the head of the Clinical Oncology Group, and I'm very pleased to be at ASCO this year, and especially glad that we were able to present this year results of our new anti-PD1 molecule, Regeneron 2810. Which was presented in a session in the melanoma session describing the promising activity we've seen in patients with cutaneous squamous cell carcinoma. That's a malignancy that often is just taken care of easily by dermatologists, but when it becomes metastatic or locally advanced and no longer easy to resect, it can actually be lethal within a year, and there has been no available standard of therapy that was proven to provide any benefit. In our study, we were able to show a 46% response rate, including some complete responses as well as partial responses. And in terms of a measure called disease control rate, which means preventing patients from progressing, that was almost 70%. The responses that we've seen have been deep and durable, and we are currently underway with another study replicating this on a much larger scale, a phase 2 study that is well on its way to being enrolled, and have opened up an additional study in a related skin cancer called basal cell carcinoma, which has similar features. And we've also opened a registrational phase 3 study in first-line lung cancer. So we are really excited to be having to present this. We worked very hard to develop an antibody that we felt would be excellent in its properties and its efficacy. It comes out of the Regeneron VelociSuite technologies that are industry-leading for developing new antibodies, identifying them, developing them, and manufacturing them. And it's just the beginning of our effort in immuno-oncology. We started this just 2 years ago, around the same time that we announced our collaboration with Sanofi. It was around also the time we started dosing patients. And we're already in multiple combination studies because it's the combinations that hold the key to the future. And the reason we decided to develop our own PD1 is really so that it could serve as a foundation for all those combinations and allow us maximum flexibility and facilitate all the efforts we would like to pursue to identify optimal combinations. So we have combinations with Sanofi assets. We have combinations going on with Regeneron assets. We have a CD20 by CD3 bispecific that is now being tested alone and in combination with 2810 in B-cell malignancies. We have a LAG-3 antibody that recently entered the clinic that is being tested alone and in combination. And we've recently announced some collaborations with other companies with which we are doing studies in combination with a vaccine for glioblastoma and an oncolytic virus for renal cell carcinoma. We've announced a collaboration with a cellular therapy CAR T-cell company called Adicet, where we think these combinations make sense, as well as our ability to generate best-in-class protein therapeutics will facilitate those cellular therapies. All this comes along with our Regeneron Genetics Center, which is another source of great insight for us into correlating genetic changes with clinical features. It has been proven useful in understanding diseases outside of oncology, and we'd like to apply it to oncology as well.